A nurse assigned to the emergency department evaluates a patient who underwent fiber optic colonoscopy 18 hours previously. The patient reports increasing abdominal pain, fever, and chills. Which of the following conditions poses the most immediate concern? A. Bowel perforation. B. Viral gastroenteritis. C. Colon cancer. D. Diverticulitis. Answer A. Bowel perforation. Rational bowel perforation is the most serious complication of fiber optic colonoscopy. Important signs include progressive abdominal pain, fever, chills, and tachycardia, which indicate advancing peritonitis. Viral gastroenteritis and colon cancer do not cause these symptoms. Diverticulitis may cause pain, fever, and chills, but is far less serious than perforation and peritonitis. The nurse is caring for an immediate post-operative client. What assessment date requires priority intervention? A. Confusion. B. Hemorrhage. C. Tracheal stenosis. D. Severe pain. Answer C. Tracheal stenosis. Rational. ABCD. Safety, psychosocial, pain, airway, choking, trachea, tracheal stenosis, tracheal edema, deviated trachea, laryngospasm, larynx, bronchioles, bronchospasm, breathing, gas exchange, lungs, dyspnea, difficulty breathing, low pulse level, low PO2 level, arterial oxygen level, pneumothorax, lung expect expansion, accessory muscle use, circulation, fluid level, heart's ability to pump oxygenated blood, hemorrhaging, lost lot of blood, dehydration, lack of fluid, fluid overload, decreased level of consciousness, change in behavior. Do not know actual cause may be low electrolytes, hypoxia, UTI, undiagnosed UTI. Keep client safe and continue gather more data to figure what is the problem. Pain could be a physical issue, first level, X, loss of life, loss of limb, chest pain. The nurse is caring for a hospice client with stage 4 pancreatic cancer. What assessment data requires priority intervention by the nurse? A. Shortness of breath. B. Urine output of 100 milliliters in 6 hours. C. Blood pressure of 96/46 mmHg. D. Back pain of 10 on a scale of 1 to 10. Answer D. Back pain of 10 on a scale of 1 to 10. Rational. Hospice client. Allow, let them die in dignity. Try to control pain as much as possible. Quality life. A breathing problem. B. Low output 180 milliliters. 6 hour is normal. C. Circulation issue. D. Pain. The nurse is caring for client diagnosed with hypertension on 25 milligrams of metoprolol POBID. Identify the following steps of the nursing and place them as order of priority. A. Hold the dose of metoprolol. B. Reassess apical pulse. C. Apical pulse auscultated at 52 bpm. Answer C. A. B. Rational intervention. B. Evaluation. And C. Assessment. The nurse is caring for an immediate post-operative client. What is a priority action by the nurse? A. Educate the client on pain medication available. B. Assist the client when getting out of bed. C. Change the client's dressing. D. Send a client to an X-ray. Answer B. Assist the client when getting out of bed. Rational, a psychosocial issue. B. Safety issue. C and D. Nursing task. The nurse is caring for a homeless client. What is priority to assess? A. Family support and coping. B. Literally and language preference. C. Clothing and shelter. D. Knowledge of disease process. Answer C. Clothing and shelter. Rational, a love and belongs. B. Self-esteem and self-actualization. C. Essential for living. A client admitted to the hospital with a diagnosis of cirrhosis has massive ascites and difficulty breathing. The nurse performs which intervention as a priority measure to assist the client with breathing? Repositions side to side every 2 hours. B. Elevates the head of the bed 60 degrees. C. Auscultates the lung field every 4 hours. D. Encourages deep breathing exercises every 2 hours. Answer. B. Elevates the head of the bed 60 degrees. Rational. The client is having difficulty breathing because of upward pressure on the diaphragm from the acidic fluid. Elevating the head of the bed enlists the aid of gravity in relieving pressure on the diaphragm. The other options are general measures to promote lung expansion in the client with ascites. But the priority measure is the one that relieves diaphragmatic pressure. A nurse is scheduling a client for diagnostic studies of gastrointestinal (GI) system. Which of the following studies, if ordered, should the nurse schedule last? A. Ultrasound. B. Colonoscopy. C. Barium enema. D. Computed tomography. Answer. C. Barium enema. Rational. When barium is instilled into the lower GI tract, it may take up to 72 hours to clear the GI tract. The presence of barium could cause interference with obtaining clear visualization and accurate results of the other tests listed, if performed before the client has fully excreted the barium. For this reason, diagnostic studies that involve barium contrast are scheduled at the conclusion of other medical imaging studies. A nurse is formulating a plan of care for a client receiving enteral feedings. The nurse identifies which nursing diagnosis as the highest priority for this client. A. Diarrhea. B. Risk for aspiration. C. Risk for deficient fluid volume. D. Unbalanced nutrition, less than body requirements. Answer. B. Risk for aspiration. Rational. Any condition in which gastrointestinal motility is slowed or esophageal reflux is possible places a client at risk for aspiration. Although options 1, 3, and the fourth may be a concern, these are not the priority. A client arrives at the emergency department with upper gastrointestinal (GI) bleeding and is in moderate distress. The priority nursing action is to A. Obtain vital signs. B. Ask the client about the precipitating event. C. Complete an abdominal physical assessment. D. Insert a nasogastric ink tube and hematisthemesis. Answer. A. Obtain vital signs. Rational. The priority action is to obtain vital signs to determine whether the client is in shock from blood loss and to obtain a baseline by which to monitor the progress of treatment. The client may not be able to provide subjective data until the immediate physical needs are met. Insertion of an ink tube may be prescribed but is not the priority action. A complete abdominal physical assessment needs to be performed but is not the priority. A client with a history of suicide attempts is admitted to the mental health unit with a diagnosis of depression. Upon the client's arrival, the client's therapist reports to the nurse that the client telephoned the therapist earlier in the evening and reported having an overwhelming suicidal thoughts. Keeping this information in mind, the priority of the nurse is to assess for A. Interaction with peers. B. The presence of suicidal thoughts. C. The amount of food intake for the past 24 hours. D. Information regarding the past medication regimen. Answer. B. The presence of suicidal thoughts. Rational. The critical information from the therapist is that the client is having thoughts of self-harm. Therefore, the nurse needs further information about present thoughts of suicide so that the treatment plan may be as appropriate as possible. The nurse must make sure the client is safe. The items in options A, C, and D should be assessed. However, evaluation for suicide potential is most important. A group of health nurse is caring for a group of homeless people. When planning for the potential needs of this group, what is the most immediate concern? A. Peer support through structured groups. B. Finding affordable housing for the group. C. Setting up a 24-hour crisis center and hotline. D. Meeting the basic needs to ensure that adequate food, shelter, and clothing are available? Answer D. Meeting the basic needs to ensure that adequate food, shelter, and clothing are available. Rational. The question asks about the immediate concern. The ABCs of community health are always attending to people's basic needs of food, shelter, and clothing. Options A, B, and C are other activities that may be completed at a later time. A community health nurse is working with older residents who were involved in a recent flood. Many of the residents are emotionally despondent and they refuse to leave their homes for days. When planning for rescue and relocation of these older residents, what is the first item that the nurse needs to consider? A. Contacting the older residents' families. B. Attending to the emotional needs of the older residents. C. Arranging for ambulance transportation for the oldest residents. D. Attending to the nutritional status and basic needs of the older residents. Answer D. Attending to the nutritional status and basic needs of the older residents. Rational. The question asks about the first thing that the nurse needs to consider. The ABCs of community health are always attending to people's basic needs of food, shelter, and clothing. Options A, B, and C are other activities that may or may not be needed at a later date. A client is scheduled for an arteriogram using a radio-page eye. The nurse assesses which most critical item before the procedure. A. Vital signs. B. Intake and output. C. Height and weight. D. Allergy to iodine or shellfish. Answer D. Allergy to iodine or shellfish. Rational. Allergy to iodine or seafood is associated with allergy to the radio-opaque dye that is used for medical imaging examinations. Informed consent is necessary because an arteriogram requires the injection of a radio-opaque dye into the blood vessel. Although options A, B, and C are components of the pre-procedure assessment, the risks of allergic reaction and possible anaphylaxis are the most critical. A client in a long-term care facility has had a series of gastrointestinal (GI) diagnostic tests, including an upper GI series and endoscopies. Upon return to the long-term care facility, the priority nursing assessment should focus on the comfort level. B. Activity tolerance. C. The level of consciousness. D. The hydration and nutrition status. Answer D. The hydration and nutrition status. Rational. Many of the diagnostic studies to identify GI disorders require that the GI tract be cleaned, usually with laxatives and enemas, before testing. In addition, the client most often takes nothing by mouth before and during the testing period. Because the studies may be done over a period that exceeds 24 hours, the client may become dehydrated and/or malnourished. Although options A, B, and C may be components of the assessment, option D is the priority. A nurse is assessing a 39-year-old Caucasian female client. The client has a blood pressure (BP) of 150/90 of a millimeter Hg at rest, a total cholesterol of level of 190 milligrams per deciliter, and a fasting blood glucose level of 110 milligrams per deciliter. The nurse would place priority on which risk factor for coronary heart disease (CHD) in this client? Age. B. Hypertension. C. Hyperlipidemia. D. Glucose intolerance. Answer B. Hypertension. Rational. Hypertension, cigarette smoking, and hyperlipidemia are major risk factors for CHD. Glucose intolerance, obesity, and response to stress are also contributing factors. An age of more than 40 years is a non-modifiable risk factor. A cholesterol level of 190 milligrams per deciliter and a blood glucose level of 110 milligrams per deciliter are within the normal range. The nurse places priority on major risk factors that need modification. A labor room nurse is caring for a client in labor with a known history of sickle cell anemia. Which priority action would a nurse implement to assist in preventing a sickle cell crisis from occurring during labor? A. Continually reassuring coach the client. B. Administer the prescribed oxygen throughout labor. C. Maintain strict asepsis throughout the labor process. D. Increase the intravenous IV fluids if the client complains of feeling thirsty. Answer. B. Administer the prescribed oxygen throughout labor. Rational. During the labor process, the client is at high risk for being unable to meet the oxygen demands of labor and is at high risk for sickle cell crisis. An intervention to prevent sickle cell crisis during labor includes administering oxygen. Options A and C are appropriate interventions during labor but are not specific to sickle cell anemia. Intravenous fluids may need to be increased, but a physician's order is needed to do so. A registered nurse (RN) has delegated care of a newly post-operative client to a licensed practical nurse (LPN). The LPN notifies the RN that the client's blood pressure and respirations are elevated from the baseline readings and that the client is complaining of pain and dyspnea. The RN takes which action next? The RN need not to carry out further assessment because the LPN is very experienced and trustworthy. B. The RN requests that the LPN offer the client opioid analgesic, which has ordered postoperatively. C. The RN places a call to the attending surgeon and reports that the client is having pain and dyspnea. D. The RN assesses the client, checks the client's surgical notes, and gathers addition data before calling the surgeon. Answer. D. The RN assesses the client, checks the client's surgical notes, and gathers addition data before calling the surgeon. Rational. The RN must not depend exclusively on the judgment of an LPN because the RN is responsible for supervising those to whom client care has been delegated. The client has recently had surgery, and there is the potential for complications, which may be signaled by alterations in vital signs and respiratory status. An analgesic may be needed, but in order to make that determination, the RN must have more information. A call to the surgeon may be warranted, but the RN has insufficient data at this time. In order to provide the client with the degree of care required, the nurse must assess the client, gather additional information, and analyze that information before notifying the surgeon. A nurse is caring for a client who has wrist restraints applied. Which nursing intervention would receive highest priority regarding the wrist restraints? A. Providing range of motion exercises to the wrists. B. Removing the restraints periodically per agency guidelines. C. Applying lotion to the skin under the restraints. D. Assessing color, sensation, and pulses distal to the restraint. Answer. D. Assessing color, sensation, and pulses distal to the restraint. Rational. Assessing color, sensation, and pulses distal to the restraint determines the presence of neurovascular compromise that is associated with the use of restraints. All of the other interventions should be implemented, but option 4 is the priority. A nurse is caring for a client with preeclampsia who suddenly progresses to an eclamptic state. The initial nursing action would be to A. Check the fetal heart rate. B. Check the maternal blood pressure. C. Maintain an open airway. D. Administer oxygen to the mother by face mask. Answer. C. Maintain an open airway. Rational. The initial nursing action when a client progresses to an eclamptic state, has a seizure, is to maintain an open airway. Options A, B, and D are procedures that may be implemented, but option 3 identifies the initial action. A nurse has just administered a dose of hydralazine hydrochloride aprazoline intravenously to a client. Based on the action of this medication, the nurse would initially assess the client's A. Cardiac rhythm. B. Oxygen saturation. C. Blood pressure. D. Respiratory rate. Answer: C. Blood pressure. Rational. Hydralazine is a powerful vasodilator that exerts its action on the smooth muscle walls of arterioles. After an intravenous dose is administered, the nurse should check the client's blood pressure every 5 minutes until stable and every 15 minutes thereafter, or per agency procedure. Although options 8B and D are a component of the assessment based on the action of the medication, the nurse would initially check the client's blood pressure. A client is brought to the emergency department by the police after having lacerated both wrists in a suicide attempt. The nurse should take which initial action? A. Examine and treat the wound sites. B. Obtain and record a detailed history. C. Encourage and assist the client to ventilate feelings. D. Administer an anti-anxiety agent. Answer: examine and treat the wound sites. Rational. The client has a physiological injury, and the nurse would initially examine and treat the wound sites because of bleeding. Although options B, C, and D may be appropriate at some point, the initial action would need to be to treat the wounds. A nurse is assigned to provide care to a client in labor and will care for the client throughout labor and into the postpartum period. The nurse assists in developing a plan of care and determines that the priority assessment in the 4th stage of labor is which of the following? Assessing the uterine fundus and lochia. B. Checking the mother's temperature. C. Encouraging food and fluid intake. D. Providing privacy for the parents and their newborn infant. Answer: assessing the uterine fundus and lochia. Rational. The 4th stage of labor is the stage of physical recovery for the mother and newborn infant. It lasts from the delivery of the placenta through the first 1 to 4 hours after birth. A potential complication following delivery is hemorrhage. The most significant source of bleeding is the site where the placenta is implanted. It is critical that the uterus remain contracted and that vaginal blood flow is monitored every 15 minutes for the first 1 to 2 hours. Although options B, C, and D are also interventions during this stage, they are not the priority. A primigravida is admitted to the labor unit. During the assessment of the client, her membranes rupture spontaneously. The priority nursing action is which of the following? A. Monitor the contraction pattern. B. Assess the fetal heart rate. C. Note the amount, color, and odor of the amniotic fluid. D. Check maternal vital signs. Answer: B. Assess the fetal heart rate. Rational. When the membrane rupture in the birth setting, the nurse immediately checks the fetal heart rate to detect changes associated with prolapse or compression of the umbilical cord. Options 8, C, and D may be a component of care but are not the priority action. A nurse in a post-anesthesia care unit (PACU) receives a client transferred from the operating room. The PACU nurse assesses the client for which of the following? First, active bowel sounds. B. Adequate urine output. C. Orientation to the surroundings. D. A patent airway. Answer: D. A patent airway. Rational. After a transfer from the operating room, the PACU nurse performs an assessment of the client. The ABC's airway, breathing, and circulation must be assessed first. Urine output and orientation to the surroundings might also be assessed, but these are not the first actions. The client might not have active bowel sounds at this time because of the effects of anesthesia. A client with mania will be placed in seclusion after overturning 2 tables and throwing a chair against the wall. Before placing the client in seclusion, the nurse would first inspect the client for injuries resulting from the incident and initiate appropriate treatment. B. Document the behavior leading to seclusion. C. Document the time and the client is placed in seclusion. D. Make sure that there is a written order by the physician allowing for the seclusion. Answer: inspect the client for injuries resulting from the incident and initiate appropriate treatment. Rational. The primary concern of the nurse should be to ascertain that the client is injury-free. to attend to any injuries that may have resulted. Options B, C, and D are all important tasks for the nurse, but they do not refer to assessment of the client and would not be the nurse's first action. A nurse responds to an external disaster that occurred in a large city when a building collapsed. Numerous victims require treatment. Which victim will the nurse attend to first? An alert victim who has numerous bruises on the arms and legs. B. A victim with a partial amputation of a leg who is bleeding profusely. C. A hysterical victim who received a head injury. D. A victim who sustained multiple serious injuries and is deceased. Answer B. A victim with a partial amputation of a leg who is bleeding profusely. Rational. The nurse determines which victim will be attended to first on the basis of the acuity level of the victims involved. In the disaster, the priority victim is the one who must be treated immediately or life, limb, or vision will be threatened. This victim is categorized as emergent. Option 2. The victim who requires treatment, but life, limb, or vision is not threatened if care can be provided within 1 to 2 hours is considered urgent and is the second priority. Option 3. The victim who requires evaluation and possible treatment but for whom time is not a critical factor is categorized as non-urgent and is the third priority. Option 1. A nurse manager of a medical surgical unit returns to work after being on vacation for a week. It is the beginning of the shift, and the nurse manager is faced with several activities that need attention. Which activity will the nurse manager attend to first? A. A crash cart needs checking. B. Client assignments for the day. C. A phone message that indicates that the charge nurse of the next shift is ill and will not be reporting to work. E. A stack of mail from the Education Department and Administrative Services. Answer B. Client assignments for the day. Rational. The nurse manager needs to attend to the client assignments first. Client care is the priority. In addition, the nursing staff needs assignments so that they can begin client assessments and begin delivering client care. The nurse manager should next check the crash cart, which is normally done every shift to ensure that needed equipment is available in the event of an emergency. The nurse manager could also delegate this task to another registered nurse while client assignments are being planned. The nurse manager would next begin the problem-solving process related to finding a charge nurse for the next shift. Because this activity directly affects client care, this would be done before reading the stack of mail. A registered nurse (RN) must determine how best to assign coworkers, another RN and one licensed practical nurse (LPN) to provide care to a group of clients. Which of the following is the appropriate assignment? The RN is assigned to care for an unemployed 26-year-old woman newly diagnosed with acquired immunodeficiency syndrome (AIDS), who has 4 school-age children. B. The LPN is assigned to care for a 41-year-old male, post-resection of an acoustic neuroma 2 days ago, transferred from the intensive care unit ICU this morning. C. The LPN is assigned to provide discharge teaching about medications and maintenance of nephrostomy tube to a 35-year-old man. D. The RN is assigned to care for a 65-year-old woman hospitalized because of chest pain, being discharged today to home with no medication. Answer. The RN is assigned to care for an unemployed 26-year-old woman newly diagnosed with acquired immunodeficiency syndrome (AIDS), who has 4 school-age children. Rational. In order to determine what can and cannot be delegated to a coworker, several factors need to be considered. The nurse must carefully consider what level of care each client requires immediately and potentially in the future, what competencies are possessed by coworkers, and what legal limitations there are on the practice of those coworkers. In option 2, the client has undergone a serious neurosurgical procedure that can impair swallowing and gag reflexes, and there is significant risk of increased intracranial pressure in the first few days post-operatively. This and the fact that the client has been transferred from the ICU this morning make this an inappropriate assignment for an LPN. The LPN is also not able to provide discharge teaching on medications and treatments to a client. Teaching is a professional responsibility, which the RN cannot delegate to anyone except another RN. Making option 3 incorrect. Although under some circumstances the RN might care for a client being discharged following chest pain, the question tells you that there is an LPN available. The RN would be best used to care for the client with more critical or complicated needs. Option 4 is therefore incorrect. The woman newly diagnosed with AIDS, who is unemployed and with small children, is likely to be in need of the skills of an RN in terms of both physiological and psychosocial needs, making option 1 an appropriate assignment. A nurse manager is planning the client assignments for the day. Which of the following clients would a nurse assign to the nursing assistant? A 2-day post-operative client who had a below-the-knee amputation. B. A client on a 24-hour urine collection who is on strict bed rest. C. A client scheduled to be discharged after coronary artery bypass surgery. D. A client scheduled for a cardiac catheterization. Answer: B. A client on a 24-hour urine collection who is on strict bed rest. Rational: the registered nurse is legally responsible for client assignments and must assign tasks on the basis of the guidelines of Nurse Practice Acts and the job description of the employing agency. A 2-day post-operative client who had a below-the-knee amputation will require both physiological and psychosocial care. A client scheduled to be discharged after coronary artery bypass surgery will require reinforcement of home care management. A client scheduled for a cardiac catheterization requires physiological needs and frequent nursing assessments. The nursing assistant has been trained to care for a client on bed rest and on urine collections. The nurse manager would provide instructions to the nursing assistant regarding the tasks, but the tasks required for this client are within the role description of a nursing assistant. A client is 3 hours post-operative following a right upper lobectomy. The collection chamber of the closed pleural drainage system contains 400 milliliters of bloody drainage. The client's vital signs are blood pressure 150ths of a millimeter of mercury, heart rate of 100 beats per minute, and respiratory rate 26 breaths per minute. There is intermittent bubbling in the water seal chamber. 1 hour following the initial assessment, the nurse notes that the bubbling in the water seal chamber is now constant and the client appears dyspneic. The nurse should first check a lung sound. B. Vital sign. C. The chest tube connection. D. The amount of drainage. Answer: C. The chest tube connection. Rational: constant bubbling in the water seal chamber indicates an air leak. This is most likely related to an air leak caused by a loose connection. Other causes might be a tear or incision in the pulmonary pleura, which requires physician intervention. Although the items in options A, B, and D need to be assessed, they should be performed after initial attempts to locate and correct the air leak.